While the government tries to hide the consequences of inflation in their official statistics, Americans see and feel it every day. Join the Mises Institute in Tampa on February 17th for our first event of 2024. We'll discuss inflation, its causes, consequences, and cure. Tom DiLorenzo, Joe Salerno, and Patrick Newman will uncover the state's deceit to reveal inflation for what it really is: deliberate debasement of the dollar to create winners and losers. Sign up now at Mises.org/Tampa 2024 and use code ACTION24 for 15% off admission. What is the state? How does it preserve itself? What does it fear? These are the questions Murray Rothbard uncovers in his powerful book, Anatomy of the State. Thanks to our generous donors, the Mises Institute is offering a free copy of this Rothbard classic to Human Action Podcast listeners. Get your copy at Mises.org/HAPod free. That's HA like human action, pod free. This is the Human Action Podcast, where we debunk the economic, political, and even cultural myths of the days. Here's your host, Dr. Bob Murphy.
Murray, welcome back to the Human Action Podcast.
Well, great to be with you, Bob, and a Happy New Year to you and all your listeners, and hopefully we'll have a big leap toward freedom this year.
Hopefully. Maybe this is the one. So perhaps pursuant to that end, you're starting a course on healthcare, as I understand it. Can you tell us a little bit about that? Like how you came to choose this topic and such?
Yeah, I guess it was about a year and a half or so ago. I was on a podcast with Charles Frohman, who has this Freedom Hub podcast and other things that he does as a lobbyist and as a agent for healthcare products. And I was introduced to James Lyons Wheeler, who had the idea of putting together a course. And he also has this website, ipac-edu.org, where there's wonderful courses on healthcare and medicine that are delivered by top people across the country in various fields of expertise. And so he emailed me a few months ago saying, would you be interested in doing a course that would really drill down on this whole economics of healthcare? Because as I'll go through the numbers with you, Bob, it's staggering how much the American people are paying for, quote, healthcare. And I don't use the word healthcare. We should use the word medical care, because that's what you're paying for, a medical service. And as I like to point out, healthcare is our responsibility as individuals, as human beings, that just as we're responsible for our own food intake and our shelter and clothing and other things that we desire as human beings, health is something that should be foremost in our priorities as to living a good, productive life. And if you don't have your health, as they say, you don't have much going for you. So anyway, James contacted Anthony Samaroff of Scotland to put together a course. Well, actually, he put together the course, and we looked at it and said, this would really be wonderful to bring it to a broad audience of looking at the economics of healthcare and wellness. Because one of the things that I think a lot of physicians are figuring out and a lot of analysts are figuring out, we do not have, quote, healthcare in America. We have sick care. We basically go to a physician when we're sick. And there's a whole idea out there among the medical community, not obviously everybody, otherwise we wouldn't be in the shape that we're in today in terms of costs and the quality of life that a lot of people have, is that we go to the doctor when something has gone wrong. And the thesis would be, from the perspective of wellness, is that doctors should help us stay healthy instead of just treating us for an illness that comes about. And
hey, Murray, let me stop you just so the listeners know. So we timed the release of this episode that if they're hearing it, when does this course actually start? Like this, in a sense, is like a commercial.
January 17th. It'll be 7 p.m. That's the tentative time we have scheduled. Mm-hmm. And you can register for it at ipac-edu.org. And all the topics are listed there for the 15 weeks. And the theme of the course is really what incentives have been put in place over the last several decades that have given us, and these are staggering numbers, Bob. I don't know if your audience is familiar with it. This is from the CDC's website, so we know it has to be accurate, right?
Exactly.
$4.1 trillion a year on medical care costs in America. That is so staggering. It's nearly 20% of GDP, and it's probably increasing at, I don't know, 5-6% a year. And we know from the consumer price index that healthcare, medical care, has been the fastest rising component of the CPI for the last 24 years, and probably even before that as well. I just have the numbers from 2000. So we know that there's something broken in a quote a system, which is really not a system, sort of a hodgepodge of Medicare, Medicaid, employer-based insurance, private insurance, Obamacare. So it's a real hodgepodge of how we deliver medical care to the American people. But the point I want to get to about the wellness component of the course is that 6 in 10 adult Americans have one chronic illness, and 4 out of 10 Americans have 2 chronic illnesses. And what are those illnesses? Cancer, heart disease, kidney problems, COPD, lung problems. And the interesting thing about this is that this didn't come out of the blue. And the CDC says on its page, it's a wonderful page on data regarding the macro aspects of medical care in the United States. Most of these illnesses are because of lifestyle choices. And what are the lifestyle choices? We know tobacco, alcohol, lack of exercise, eating the wrong foods. And I don't know if you saw this the other day on LouRockwell.com, but there was a post of a video by a physician who wrote a wonderful book on macular degeneration. He's an ophthalmologist. And the thesis in his book is that macular degeneration, which affects millions and millions of Americans, and we have a personal situation, and my wife has it also. And his thesis is that it's diet related. It's not genetics. It's not environmental. It's basically diet. And he goes through it. And in his presentation that was posted on LouRockwell.com, which was given in Australia, he points out that vegetable oils are really the culprit in the chronic illnesses that affect the American people. So if that's the case, then why are food companies, still putting vegetable oil in their products? And that packaged foods, we have to look very careful at the labels. We are very conscious when we go to the supermarket looking at labels now. And it's very tough to find food products, especially packaged food products, that are so-called clean, that don't have all these things in there that are considered very, very unhealthy, like the vegetable seed oil. And so what we hope to do in this course is to present a lot of information on a weekly basis so people can get a better sense of where we are, how we got here, and what are the things that they can do as individuals to improve their health and to reduce their medical care costs. Because I think there is plenty evidence if we restructure the medical delivery system that we could probably reduce healthcare costs in this country by a third to maybe 50% or more. Because as I like to let people know, that I think one of the reasons we have this problem is that we're overinsured, over-medicated, over-regulated, and unfortunately we're overeating and over-drinking and smoking too much. So when you put all that together, there's a lot of work to be done to improve the American people's medical care and or health by having a much more rational medical care system. And we want to look at the incentives that have been put into place over the decades, because as we know, incentives matter.
Well, yeah, a lot there. Just to respond to a few of your points, and I don't know if you know this, Murray, but I co-wrote a book on some of these topics with Doug McGuff, who's an ER doctor. And so, yeah, this is something. The stuff I did was like right when Obamacare had gone through. So here's something that I don't know if you've noticed this. I think people, let's call them right wingers or conservative libertarian types in general, when they grapple with progressives who want more government involvement in healthcare, or you say medical care, I think sometimes the trap they fall into, like they'll see statistics like the ones you said about, oh yeah, the U.S. spending is way higher per capita than anywhere else in the world, and then typically too, the progressive critic of the U.S. system will couple that statistic with saying by conventional metrics about, the performance of these like health outcomes or whatever, the US at best is like the middle of the pack, and yet by far they spend way more. So in terms of bang for the buck, the US, seems lacking compared to a lot of other countries. And so a lot of times the people presenting those statistics, they're doing it to argue for universal payer or that sort of thing. And so that's why I understand how the people on the right recoil against that. But I think they're in their zeal to avoid the prescription that's offered, they're ignoring the diagnosis too.
Right.
And I think that no, people, it's not the case, and you're actually doing a disservice, I would say, to the free market if you're saying no, U.S. healthcare system's great, this is capitalism for the win, and yeah, we spend a lot, but that's because we have more MRIs per capita, and we don't have long wait lines. So like some of those facts are true, but if they come off as saying that yes, what we have in the U.S. is a free market in medical services, and we spend a lot because we got a lot of rich people, rich elderly people here who are willing to pay for it. What's your problem? I think that's very obtuse, and they're really giving too much ground to the left. How do you feel about that?
Oh, there's no question about it. The way I like to present this issue when I would do interviews, so when I was promoting my two healthcare books on how we can create a universal medical care system based upon the single pay, not the single payer, but the individual payer, the doctor-patient relationship, as opposed to the Medicare for all. And my most recent book on the finance of healthcare, which is addressed to entrepreneurs and how they can reduce their medical care costs for their employees. I like to put this in historical perspective, since I do have, at this stage of my life, a very long historical perspective on medical care. And I think the first time I ever saw a physician was, I think, in the mid-1950s, after I broke my arm in the summer, July 4th, 1955, Bob. I broke my arm in the Catskills when we were on summer vacation, and I spent over 4 weeks in the hospital in traction because
Did a firework blow up in your face?
What happened was I fell off one of those sliders that you see in a playground, and I fell over, and there was a rock at the bottom, and I don't remember actually falling. I just remember waking up, and my arm was throbbing, and what happened is my elbow shifted 180 degrees. It was twisted. So I remember being operated in the hospital room. They put needles in. They put me in traction, and I was in traction for over 4 weeks as an 8-year-old. And that was not a pleasant time. Then I had a cast, then I had a sling. So it was about a 3-month situation. And I saw my younger brother's pediatrician in the Bronx where we were living. And I think that was the first time I saw a physician, and the visit was $5. So I think one of the themes of this course could be, whatever happened to the $5 office visit? And today we don't even know what the cost is, because our insurance companies pays for it, and then we pay a copay for 15 or 10 or whatever it is. And so we really don't know what the fee for service is with the type of medical care that I got when I was a kid. And my father was a blue collar worker. He had Blue Cross Blue Shield. And in 1961, he had a major operation that was done at a New York City hospital, one of the premier private hospitals in New York City. I don't know if they're still around. But he was making, I don't know, $3, $4 an hour at the time. And Blue Cross Blue Shield covered the hospitalization and the surgery, the anesthesia. Remember, this is 4 years before the introduction of Medicare and Medicaid. I want people to remember that. The mid-1960s was really a revolution in medical care. Plus, we also got the HMOs, the health maintenance organizations, that were supposed to put a damper on healthcare costs. And we're going to explore this in the course, because you need a historical perspective on all these issues that people are focusing on today, whether it's education, whether it's obviously what we write about, the business cycle and the Federal Reserve, and transportation, and now healthcare, which is, I think, the biggest financial issue, in addition to the federal budget being out of whack with nearly $1 trillion of interest costs. So how did we get from $5 office visits, and maybe for adults it was $7 or $8 back in the 1950s, to where it is today? So even on an inflation-adjusted basis, let's assume prices are up tenfold since the mid-1950s, then we should be looking at if medical care costs or doctor's visits went up at quote, as the average rate of inflation, we should be paying about $50 to $80 to $100 for a visit. And we know some visits are $200, $300, $400 for some doctors, especially specialty doctors, cardiologists, neurologists, what have you. And we know that hospital stays are just off the charts. What are they? $1,000 a day, Bob, in most parts of the country for a hospital day. And we know surgeries have gone through the roof. And we're going to explore alternatives. And as you well know, and as members of the audience will know, we have something that can be replicated all across the country, like the Surgery Center of Oklahoma, which charges 50 to I think 80% less than what hospitals do for similar surgery, and they have as good or better outcomes than hospitals. So if we have a way of delivering medical care that is high quality, low cost, why isn't that replicated throughout the United States? I think that's a very important question to ask, because doctors have more freedom when they're operating in an entrepreneurial setting than they do in this corporate setting. And as we've seen, my physician in New Jersey, when we lived in New Jersey, that office is now part of a corporate entity. The hospitals are now buying up practices, which is another reason that we're seeing the distortions in the medical care system. And having moved to Southwest Florida 2.5 years ago, I see the distortions firsthand, because when we came down here, Bob, if you're a new patient, it took months to get a first visit.
Right.
Now, that to me is mind-boggling, that it takes 3-4 months to get to see a doctor. And if you have a serious ailment, then they send you to the ER, which costs, I don't know, 10 times what a doctor's visit would be. So we have a real serious problem. The other thing we're noticing, and it was written up in the local paper here in Southwest Florida, they're projecting doctor shortages in Florida over the next several years, because medical students who are in Florida medical schools are leaving for other parts of the country where they may be initially living in. So I think we're going to see a tremendous strain on the medical care system. And I think this course will help us sort out these issues and to try to come up with proposals. I think James, who's head of IPAC, I think he wants to package this as a book with essays and interviews with people. And I would love to have you on the show or the course to talk about your findings in medical care. Your co-author, Doug McGuff, I saw his YouTube presentation from a conference years ago. He's an ER doctor, as I recall. Is that right, Bob?
Mm-hmm. Yep.
And he described historically how this thing evolved with Blue Cross Blue Shield from the 1930s. And that's why, having been a history major, I am fascinated by the evolution of American society, or any society for that matter, and how these ideas first get introduced, get ignored or shot down, and then years later they get resurrected as the answer, the cure, if you will, for these issues. And we see this in healthcare. And again, having done a lot of research in the history of medical care, I think it's one of the most fascinating aspects of American history, is that we've gone from the doctor-patient relationship from decades ago, and not too long ago, since I was part of that system. And if you needed to see a specialist, your GP or pediatrician would send you to a specialist for any ailment. And thank goodness most young people are healthy, so you don't have to see a specialist that often. But if you did, it was a routine visit, and it wasn't prohibitive, expensive. And so what we hope to do in this course is to go each week into the incentives and disincentives that has given us this $4 trillion cost of medical care. And the more you look at this issue from a human action perspective, and let's use the term of the podcast, from a human action perspective, is that medical care is no different, even though economists will say it is, than any other service that we get in the marketplace, that you have supply, demand, you have subjective value, you have time preference. And if we apply Austrian economic principles to medical care, I think we would come up with a better approach than we have today. And I hope this course will get the type of attention, because I think we're going to provide a very valuable bit of information for attendees, and that people understand that there's no reason whatsoever for the government to be involved in medical care, and that the incentives that have been put into place has made things very expensive, and that's why some people have opted out of the system, and they're willing to pay on an ongoing basis and have maybe an insurance policy for a catastrophic cost, which even that could be reduced if we apply some common sense in terms of how we treat illnesses. Yeah, I think there's a lot of work to be done in a sector, Bob, that is really consuming resources that could be used for better purposes, that to make the economy more competitive, because when you go to a doctor's office, it's amazing how many people are there just doing paperwork
Mhm.
for Medicare, Medicaid, and the insurance companies. And that, to me, is a dead weight of on the sector, because they're not producing any medical services. They're just complying with uh, the regulations and the payment that they need to get to keep the office open. And so, one of the medical people that my wife saw while we were down here, he used to be in Medicare, but he opted out because he said it took over a year to get paid for Medicare. And that's just an untenable situation if you're any sort of professional or practitioner, is to get paid a year for your services. So you can see there are problems in the medical care system that needs to be addressed.
Yeah, a lot there. You're right. So for probably at this point, most of our viewers are aware of this, but in case you're not, that yeah, people get upset like, yeah, I went to see the doctor and he wasn't even looking at me half the time. He was just, typing stuff on the computer. And that's partly because they have to do that. Like
Yes.
if they are embedded within this system and they're playing by the rules, then yeah, they have to document everything. Otherwise, they're not going to get the claim, the reimbursement from either the health insurance, the private insurer, or the government payee on that particular service. And so that's why I got to do all that stuff.
But it's even worse. I mean, doctors could be penalized financially and maybe criminally if they put the wrong code in for
Right,
Medicare or
right.
Medicaid. I mean,
Mhm.
that is so mind-boggling that you would penalize people for making uh, a mistake. I mean, it just shows you the current system that we have today is not about good outcomes. It's about rules and regulations which don't benefit the patient.
Yeah, and you mentioned for people again. I'm sure most of the people listening to this are going to be tracking along, but in case someone does have concerns, this isn't just all theoretical. Like, oh, we like the free market and government's bad. Like as you say, Murray, the Surgery Center of Oklahoma. I've had Dr. Smith on. I think he was on this show, and then other podcasts I've hosted before, interviewed him in different contexts. And yeah, just the results they're providing. And so for folks who don't know, go ahead and look them up. Like literally, if you got some medical issue, you may want to go there. That they don't even take regular insurance. They don't take Medicare, and it's just everything's cash. But because they get rid of so much overhead
Mhm.
and just they get paid promptly and such, that they can afford to, as you say, Murray, give, especially like with prescription medication, they can afford to give it. I think he was saying sometimes it's like a 95% cheaper, and just because that just shows how much of a markup there is on things and certain procedures. And again, folks, it's like somebody in another city, it's cheaper for them and they get it done faster if they schedule a trip. They fly to Oklahoma, have this procedure done there, and then stay in a hotel a week to recover, and then fly back home. And it's all, they all pay out of pocket cash for that. And it's still cheaper to them than if they did it the conventional way at their local hospital, even if they have a good insurance plan, with what they would be paying out of pocket, even after insurance picked up most of the bill.
Let me give you
Yeah.
a real life
Hmm.
example. When I was researching my first book, I came across a direct primary care physician here in Southwest Florida. And for listeners who don't know, direct primary care is a very simple business model. You pay a monthly fee to the doctor, and the doctor is available virtually 24/7. And the doctor only has between 800 and 1,000 patients, which makes it very easy to see a doctor just about any time you want, as opposed to a doctor in a regular practice, which has about 2,000 or more patients. Anyway, I interviewed this doctor who does direct primary care, and she told me she had a patient with no insurance, and he needed some sort of surgery. I forgot if it was either a hip or a knee. And the local hospital, because he was not insured, they quoted him $20,000 for the procedure. And so the doctor said, you should contact the Surgery Center of Oklahoma and see what they would charge for the same procedure. So the patient called the surgery center, and the surgery, the trip, the hotel stay, the whole thing was $5,000, Bob. I
Mm.
mean, when you compare the cost of what a local hospital would charge a non-insured patient with what the Surgery Center of Oklahoma, for a lot of people, they've sat down and done the numbers and say, okay, if I have a real bad medical issue, uh, I will have saved all this money that I can pay for it, or I can get myself a catastrophic policy with maybe a $5,000 or a $10,000 deductible, whatever the case may be. But for some people, they don't want any part of the insurance industry because they figure it's very expensive, which of course it is, and we're seeing this in what employers are now paying per employee for a family of four. I think the latest numbers I saw, Bob, were well over $20,000 a year for an insurance policy. And the interesting thing is, and I felt this personally when I was teaching at Ramapo College, where we were paying nothing for our health insurance. And eventually it went up to we were paying, I think, 20% of the cost. So we're up to $5,000 a year. The only good news about that, it was with pre-tax dollars, so we weren't taxed on that $5,000 of income that we were shelling out. But again, this is a finance issue. This is an ethical issue. This is a moral issue, if you will, because there are people who believe that healthcare is a right, which is very bizarre when you look at the Bill of Rights. It's just not there. And the other thing, Bob, that I wanted to bring up is that the Constitution doesn't provide for any government involvement in healthcare or medicine. And that's why I keep on quoting Article 1, Section 8 of the Constitution. Virtually the whole federal budget is not authorized by the government. So I think we're on sound ground when we say we are in a constitutional crisis. We are in a post-constitutional America where the government is doing things that it's not authorized. And two good examples of what the old days were like, not that I was around, but when the Supreme Court struck down the income tax in 1895, what did the proponents of the income tax do? They amended the Constitution. We got the 16th Amendment. And then when the prohibitionists wanted to ban alcohol, they knew they couldn't do it by law. So we got a constitutional amendment, the 18th Amendment, that gave us prohibition. So back then, at least there was a respect for the Constitution and our constitutional republic. Today, for decades, we haven't had that. And so that's why I think we have a constitutional issue. We have obviously a medical issue, an ethical issue, a financial issue. And when you put it all together, that the reason we have this enormous medical bill for the people, and they're paying it. You see, this is why transparency is so important. The American people don't realize they're paying for the $4 trillion. The government is not paying for it. The government is just a conduit for the money that's extracted from the people, and then it goes to all the various special interests that feed at the trough in Washington, D.C. And that's, I think, a message that we need to get out, Bob, in every aspect of our society, is that the people think the government has this load of money that is just being held back because they're not in the right crowd in Washington. And so we have to let people know that government is broke, it's bankrupt, and you, the American people, are paying for everything that the government does.
Yeah, well said. It's funny you mentioned the historical, the passing those constitutional amendments. Not that you or I support as good policy, federal income tax or alcohol prohibition, but at least, like you say, they said, okay, well, the rules are the rules, and we'll go amend the Constitution.
Yep.
Another example of that is apparently when the Eisenhower administration started funding the interstate highway program, it was challenged on constitutional grounds. Like some critics said, well, how does the federal government get off, where do you get the authority to build roads? And they had to argue on national defense grounds and say, well, if we were invaded, it'd be good if we had this, interstate highway system so we could quickly move troops to blah, blah. So, that's kind of a specious defense, I think, but at least they felt the need to, whereas now, if you remember, actually it's very relevant to our conversation. One of my favorite examples of this is somebody asked Nancy Pelosi, where in the Constitution does it authorize the government to force people to get health insurance? And she just said, "Are you kidding?" Or maybe she said, "Are you serious?" Like, in other words, like the very idea that she would have to go and point to the Constitution as to where do we get the authority to pass the Affordable Care Act. Like, to her, it's like she thought the person was trolling her.
Yeah.
That, the idea that we need constitutional authority to do something like where, presumably in her mind, well, because the general welfare and this is a good thing. And,
Yeah.
of course the Constitution wants us to do things that help people. Gee.
Well, this is the problem that I've seen as a naturalized citizen, Bob. I took an oath to uphold the Constitution when I was 12 and a half years old, and I raised my right hand in front of a judge in Lower Manhattan in June of 1959. I said I would defend the Constitution. And as I got older and started reading in detail what the Constitution's all about, I said to myself, why is the federal budget what it is, given the fact that there's no authorization for these expenditures? And then when I wrote my book, Tax Free 2000, on how to create a tax-free society, and I went through all the things that the government spends money on in the federal budget and looked at the Article 1, Section 8, I said there's a real disconnect here. And I think medical care is a prime example of that. When Medicare and Medicaid came about, in 1965, that was the next leap forward, as Bob Higgs would point out in his book, Crisis and Leviathan. Even though there was no crisis in healthcare, people were getting healthcare. There were public hospitals in New York City and public facilities in other parts of the country. And doctors, I've spoken to doctors, and they said that they would provide free medical care to people in their community. They're still doing it today. In fact, there's one husband and wife doctor team who've created a nonprofit health center, medical center in Central Jersey, and she doesn't file for Medicaid claims anymore. She says it's too onerous, so she just provides medical care to some patients for free. And then she has this nonprofit medical center in Central Jersey that's been around for more than 20 years now, doing incredible medical care for low-income folks who travel sometimes 20, 30 miles to get there, which is really extraordinary in today's day and age. And this is all done without a penny of government money. In fact, I still contribute to the center because they do such great work. And my ethic tells me that I need to support people who do great work in their communities, even though I don't live in the community. I no longer have any ties to New Jersey because I'm not there, but they've done such great work. I've supported them for the time I found out about it in the early 2000s. And they do it at such a cost-effective method that this could be replicated, I think, all over the country, because there are so many retired physicians that would love to do 5, 10, 20 hours a week of volunteer work in a medical in a nonprofit medical center, and you would get rid of the $800 billion that Medicaid spends today. And we heard just what happened in California. Governor Newsom announced that CalMed, which is California's Medicaid program, will now be providing the medical care to the so-called illegals and legal immigrants in California at a cost of $3 billion a year, when the state is running a $68 billion budget deficit. So again, you can see the finances don't make sense, Bob. And now medical care has become an entitlement, part of the welfare state. And these are some of the issues we want to address, how we reorder the incentives to replicate these nonprofit medical centers all across the country, because I support 3 of them in New Jersey. One that I was a founding trustee in Bergen County when I was contacted by the founder because he heard that I was interested in nonprofit medical centers, because I hosted a symposium at Ramapo College in 2004 on that. And one of the keynote speakers was Dr. Gene Cheslock, the founder of the Parker Family Medical Center in Red Bank, New Jersey. I support them as well because they're doing great work, raising money the old-fashioned way, the voluntary method, and not being burdened by government regulations. And this can be replicated all across the country, especially in low-income communities. And we could have a much better outcome for low-income people who have, unfortunately, serious medical problem because of obesity, diabetes, and other illnesses. So again, what we want to do in this course, Bob, is to just lay it out there saying, here's the structure we have today. Here's how it came about. And here are viable solutions, not pie in the sky stuff, not theoretical stuff, but really practical applications of medical practices, good economics and finance. And the left should be thrilled about it because it means less bureaucracy. Remember, bureaucracy is not costless. Bureaucracy costs money, which doesn't provide the services that people need. So no matter what field we're in, whether it's especially education, healthcare, and other aspects of American society, if we reduce bureaucracy, then we free up resources to deliver the services in a much more cost-effective manner.
Yeah, you just reminded me of something when you said that, the left should be happy about this stuff. And I remember I was talking to, I think he was a pulmonologist. So, he was an actual MD, but also he taught at a school, university. And he was saying how they had set up a thing where I might have some of the details wrong, but the spirit of this is definitely correct, where some of their senior students, going through the medical program at the school, were going to work at a local clinic to give free medical care, to like the indigent people of the community that, they had no insurance, and, they were sitting out of the ER and that kind of thing. And so it was sort of like a win-win where, these students who needed practice, and, they would have under the oversight of their professors and whatever,
Sure.
but they would be, working with real world patients, not just a textbook or something, and then giving, free care to the people in the community that weren't getting it elsewhere. It's voluntary. They weren't rounding people up off the street and forcing them to undergo experimentation. They were saying, if you want to come here and have our students, look at you and give you some advice and whatnot. But I think the program ended up getting shut down because they were concerned about like legal issues and regulations. And I think also there was like dissatisfaction among the left about, hey, why are we giving substandard care? You wouldn't send your own kids to this thing, so why are we giving substandard care to the homeless or what? You get what I'm saying? So It was, again, a sort of thing where unless it's coming from the government and it's a program that's administered by progressives, they don't like it.
Well, this is the problem with the left, is that they really believe in egalitarianism, that everyone should have the same access to everything. Well, that's just nonsense because it just violates a very fundamental principle of human existence, that some people are more talented than others, some people have greater income than others, and that's the nature of the human experience. And they don't seem to accept that. They seem to have this crazy notion that just because you exist, you're entitled to food, clothing, shelter, cell phones, internet access, what have you, medical care, education. And they don't believe in the division of labor. They don't believe in specialization. They just think that, and this is really trickle down economics. And I've said this for a long time ago. The left really believes in trickle down economics. The money goes from the workers, the business owners, to the government, and then it trickles down in the form of programs, Medicare, Medicaid, Social Security, aid to education, food stamps, you name it. And we're supposed to accept this as the norm. And I think what we're going to be doing in this course, at least what my goal is to point out there is a better way to provide quality services to everybody. Not everyone's going to drive a Lexus or a Mercedes or a BMW. But if you can get a good used car for $10,000 through Carvana or some of the other places, or CarMax, whatever the case may be, you need transportation. Now, if you desire to have a Mercedes, then work for it. Something that I'm sure you and I learned as youngsters. If you want something, you work for it. That's what I saw my father do 5 days a week. And then he was working 7 days a week, 5 days in the sheet metal shop, and 2 days a week driving a cab in New York City. So he was working 7 days a week for not a long time. And then he finally got his own cab, and he was still working 5, 6, 7 days a week. And so that's how he provided for his family. And so when we came here as immigrants, Bob, there was, from what my parents told me, there was no idea of going, quote, on welfare. A nonprofit organization helped us out, my father told me, HIAS. At that time, it was called the Hebrew Immigrant Aid Society, and now they're just called HIAS, and they've been around since the mid-19th century, helping refugees all over the world. And so we have non-governmental institutions that do great work in every sector of the economy. And this is something that I think we need to expand our presentations, saying, here are the issues that you're concerned about, Mr. and Mrs. and Miss on the left. Here are viable solutions that go back decades before the New Deal, before the Great Society, like the mutual aid societies that David Beato writes in his wonderful book on mutual aid societies. And so people from all ethnic backgrounds, religious backgrounds, racial backgrounds develop these mutual aid societies. And so that, I think, is a big piece of the puzzle when it comes to medical care, because with what I think the numbers are 60 million, somewhere around there, of people on Medicaid. That is a shocking indictment of the U.S. economic and healthcare policy, because prior to Medicaid, people were getting medical care through their local hospitals, charity care. They still have them in New Jersey, even though they get reimbursed by the state, but they could raise the money voluntarily, as these nonprofit health centers that I've been supporting over the years. So again, we have viable solutions that are not pie in the sky, and we should just be literally beating the drum on these things, and rather than talking so much endlessly about what the problem is, we talk about how to make things better. And I think that's what I think libertarians especially should be talking about, is not decrying the current situation, but say, here are an alternative that there's no such thing as a guarantee, but is much better than the current system that is really soaking the taxpayers. And of course, giving us these, $2 trillion budget deficits in Washington.
Yeah. I wonder, Murray, do you get much into, or are you planning on getting into in this course, issues about the supply side that,
Yeah.
to me, one reason that, medical products and services are so ridiculously expensive is that there are like it's not that some entrepreneur can just open up a hospital down the street and say, oh, we'll charge you half of that fee for a nightly stay, and we won't charge you $60 for aspirin, or, some of these horror stories you see when people look at the itemized thing. When you say, well, how come someone doesn't do that? Like, one reason is, well, because it's illegal. Like, you have to get the local board to sign off on there has to be medical need or something to open up a new hospital. So that's why it's not a free market.
Oh, there's no question about it. I'll give you an example. The Bergen Volunteer Medical Initiative that I was a founding trustee for, the website is bvmi.org, located in Hackensack, New Jersey, the county seat of Bergen County. You wouldn't think that Bergen County, being a fairly wealthy community, would have the need for a nonprofit medical center, but there are pockets of low-income families in Hackensack, in Englewood, and Teaneck and other places. And so they're doing incredible. They're saving lives at no cost to the taxpayer. They have a wonderful suite of offices in Hackensack, and people come from all over the area to get care. And so this is what needs to be done, and say, listen, if it could be done here, it could be done anywhere in the country. The thing is, what are the constraints? I'm trying to think in order to open up this facility, the founding trustees decided to get an ambulatory care license from the state of New Jersey or the county. To me, all you have to do is say, we're opening this facility, here are the people involved, and we're opening our doors. And that's what should be done. Why do you need a government permission to do something that is based upon a very valuable service to people? And that's Leonard Reed's title of his book, Anything That's Peaceful. So if you're doing something that is of value to people in the community, why do we need government permission to do anything that is based upon voluntary service or production? And so that is another area. And we know the whole concept of regulatory capture. We're going to be discussing that in the courses of how the insurance companies, the pharmaceutical companies have really got their tentacles into Washington, D.C., and how medical care is really ruled by them, as opposed to the having the doctor-patient relationship be the heart of medical care in this country.
Yeah, and for people who think that where this is overblown or something, the stuff Murray and I are talking about, I mean, you can see it more cleanly in examples like where you've probably heard of these cases, Murray, where like just to do African hair braiding,
Yes,
you need a special license to do that, and in a certain community, like people, someone who's been doing it, some woman's been like her grandma taught her how to do it. She's been doing her whole life and she's the expert, and everyone who's in that sector knows she's the expert, and yet it's illegal for her to do it because this group over here won't sign off on giving her permission. And it seems like when the existing practitioners get to vote on should we allow more competition, they have very high standards, a very high threshold to prove that, oh yes, we should let someone new come in and compete with us. But what do you say, Murray, to the average person who's hearing this? They might say, sure, maybe there's mistakes on the margin, guys, but come on, you can't the government has to clearly play some role in setting a minimum standard of quality. You can't just have quacks slicing people open because they got some online degree from medical school that, brain surgeons are us. So, come on, guys, you can't just have complete anarchy when it comes to the regulation of healthcare. So would you say to someone who's got that kind of attitude?
Well, that's why we have a whole certification process. I mean, the quintessential example is Underwriters Laboratory. When you buy electoral products and you see that UL label, people realize that it's been tested in I guess it's a nonprofit organization. You have Consumer Reports. You got which tests myriad of products across the board. You have the same thing for medical care. There's an organization called MediBid, which is like the eBay of medical care, where doctors bid for patients' care. And so there are medical entrepreneurs all over the country doing things that are challenging the status quo. Medical cost sharing is another example of that, whether it's Christian-based or religious-based, or it's secular. People realizing it's more cost-effective. You have a board that oversees it of professionals in medical care and other fields, whether they're CPAs or what have you. The problem with the left is, and I think no one has really talked about this to a large degree, the people on the left don't trust people. And ironically, they're the ones that say they're for the people, but they don't trust the people to do the right things. They think that you need nameless, faceless bureaucrats to oversee this. How do we know the nameless, faceless bureaucrats are honest? And so this is the challenge that all human beings have. How do you know that you're getting quality products and quality services? Well, a good example of that is if you're a food company and if you taint your food, it's very hard to stay in business if your customers are dying. The same thing with car companies. We have a lot of regulations, as you know, in the manufacturing of automobiles. Well, it'd be very hard to sell an automobile if your transmissions fall out, if your brakes fail after a few thousand miles. So companies have to internalize the quality that they need in order to satisfy consumers. And this goes back to the whole concept of subjective value. Consumers are not stupid. I mean, we now go into the marketplace, and today you literally can go into the marketplace and get prices for different items literally at a touch of a button. You have Trivago for hotels. You have a Progressive insurance company, which gives you the prices of other insurance companies when you're looking on their website. This is incredible that a company would allow you to see their competitors' prices on their website. Mm-hmm. So again, the internet has made possible, technology has made possible for people to get more and more information. In the old days, Bob, you really had to shop around to buy a TV. You had to go from store to store. You had to go and you couldn't even look things up. You either had articles in the newspaper, or maybe go to Consumer Reports, or then go store to store to shopping. That was a lot of time used up. Now you go online and you can check a product that you want, or an item that you want, and different companies, and get that information seamlessly. You have Edmunds, you have Kelley Blue Book on automobiles. They rank automobiles. You could do the same thing for medical care as well. And so you see reviews. You go online and you see reviews either at the doctor's office website or other places. And this is the beauty of the internet, is that people, when we were looking for doctors in the area, we would see the reviews. Some were favorable, some were unfavorable. So what do? You really have to make a decision. And then you get recommendations from our primary care doctor here in Florida. So he's the one that has been vetting doctors in the area, because we live in an independent living facility. And so with an elderly population, you need to have specialists, and he does the vetting, which is great, because he's now our primary care doctor, and we trust him to get us the good specialists that we need. And so information we know is not costless, Bob, and the left thinks that everything is costless. And so what we have to tell them that life is not so simple as they make it out to be, that you just have a government program and everything is going to be well. No, you have to gather information in order to make the best decision possible for you and your family.
Yeah, well said. And it's, you mentioned the TV thing, and just this is an obvious point, but I just want to reassure. I think with a lot of these points that we're making, it's more that the listener who, yes, they believe in freedom, they believe in free markets and so on, but just, needing some reassurance about, well, what would the actual mechanics be? Like, how could this work? And just in terms of television sets like Walmart, you can go ahead and do research on different kind of TVs and performance, but you're pretty sure that if you buy a TV from Walmart, it's not going to explode.
Right.
Whereas in the Soviet Union, that really was a thing. Like, people knew, or at least I've heard this from people that seem to have actually documented it, and it's not just an old wives' tale, that like certain factor, like if you looked and saw that a product was made at the end of the week, you shouldn't use it, because that's when they were running out of parts and stuff, and they would just throw stuff together. And, if you bought a TV that was assembled on a Friday, it was much less likely to work than a TV that was made on a Monday. And so, there's that element. And so why are you thinking that? Well, it's because the people who run Walmart, they don't just go for the lowest bidder. They do research too, and they decide which brands to put on our shelves, because they know in the long run, if consumers realize, oh yeah, I bought a TV from Walmart that blew up, like literally exploded, then they're going to be distrustful of Walmart. It's not just, oh, I'm going to avoid that brand of TV. They're going to be mad at Walmart. Why did you stock that on the shelf? And so, there's vetting on the front end. Just like if you went to a brain surgeon at a hospital, the hospital's going to make sure his degree is from a reputable place and so on. They're going to make sure he has malpractice insurance, even if the law didn't require that,
Right.
Things like that. So again, because why? If your uncle died in a horrible surgery at this local hospital and it's an open free market, then you wouldn't go to that hospital anymore. You'd go somewhere else, right? So it's in their interest too, to vet the people working in their premises on the front. So again, some of these horror stories, and also too, as we say, it's not like right now the system with government intervention is great. No, the system right now is awful. And so people are just saying at best, oh, well, it'd be even more awful if we had a free market. And you and I are kind of walking through saying, well, why would that be the case? Why would you expect that?
Well, we had basically a free market medical care system before Medicare and Medicaid. I mean, as the examples I gave you, going to the pediatrician back in the 50s with my parents, it was $5 for the office visits, $7 for the home visit on Wednesdays. That's when the doctor did his visits to the home if you were sick. And I remember him coming to the home a couple of times on a Wednesday. And then as inflation reared its ugly head in the 60s, the prices went up to where it was a $10 visit or an $8 visit, whatever the case was. But the point is, inflation and medical regulations have really driven medical care costs up enormously in America. And we just have to beat that drum, is that if we want lower prices, then we have to talk about monetary policy, which of course no one wants to talk about, especially the presidential candidates. And so all this is tied in, Bob. I mean, I take this from a holistic approach, is that prices have just gone through the roof in every sector of the economy because of the Federal Reserve's money printing for the past 100 plus years, and especially the last few years. I mean, Jeremy Siegel, Wharton School, University of Penn finance professor, has a great letter in Wednesday's Wall Street Journal excoriating the Fed for its monetary policy, which gave us the inflation. And people are trying to poo-poo the inflation of the last few years. But and now, of course, what's the reaction? Biden wants Medicare to negotiate drug price, which I guess is a good thing to do, because why should the drug companies have free ride, or at least set prices without negotiation with Medicare, which pays for these prices? So the point I would make, and I think this come through the course, is that we are very heavily over-medicated. There's no question about it. And that's why we want to bring in some alternative approaches to medical care. This is not medical advice, but what people are doing right now in their practices, either from a naturopathic perspective or others, and getting good results with their patients. So again, there are many ways of delivering, quote, medical care that is not the traditional allopathic approach that's been the narrative now for more than 100 years. years. So again, we want to explore every aspect of the economics and finance of medical care and talk about how people can get healthier because as that video on LouRockwell.com the other day pointed out, I mean, it is frightening to see the curve of heart disease, diabetes, stroke, and other illnesses for the past 75 years when vegetable oils were introduced into the American diet. And I'm convinced that the diet is, I don't know, 80, 90% of the reasons that people have medical issues. So that's something we want to explore with interviews of with doctors who are using a different approach than the traditional ways of dealing with illnesses today.
Mm-hmm. Well, I got look at the clock here. Maybe one more substantive question, Murray, for you, and then I'll let you again give the details for the course for people who are hearing this in time and want to jump in. So, and with this, I think the listeners know this, and you know this, Murray, but I'm very much on your side with this. But it did occur to me, I'm trying to get in the head of the critics. So let me pose this challenge to you and see what your reaction is. What if somebody says something like, listening to our conversation thus far, and say, "Oh, you guys, what are you talking about? On the one hand, you said that we can trust consumers and we don't need regulation and licensure laws and things like that because we can trust the market to deliver good products." And you even said, Murray, something like a food company, that poisoned its customers would go out of business. But then you keep hammering home that diet is responsible for 80% of our ailments and that it's the seed oil or the vegetable oils and da-da-da. So which is it? Can we trust the free market to deliver healthy food that's good for people, or is the food killing us? So, I thought you trusted the market.
Well, the interesting thing is we know the government's food pyramid has been so wrong for so many decades, and people have been following it. Namely, that we should have a low-fat diet. We should have substitute these sugar substitutes, which, according to some people, are really terrible for you. And the food pyramid is awful. So vegetable oils have been around for a long time, promoted by the food companies. Maybe they don't know what the ramifications are, but people who've looked at the data and seen the consumption of vegetable oil, vegetable seed oil, and other ailments, and have done cross-sectional studies of societies where this product is not introduced in the marketplace. In other words, every topic has a narrative, and people either support it because they don't know any better, or they do know better, but it's their business. So the question is, the critics have a point. How do we know what information we're getting is true? Let's look at COVID now. During COVID, people were critical of the whole concept of masking and isolation and lockdowns, and critical of the so-called vaccine, and they were shut out. So if we're going to have an open, free market and discussion and transparency, then everything should be put on the table, and the news media should be part of the solution of providing different perspectives on every, especially medical issue facing the country.
Okay, great. So again, can you give the details for those who are catching this in time and want to tune in?
The website is ipak-edu.org, and you can go and look for the course. It's called The Economics of Healthcare. And it's called the Economics of Healthcare and Wellness, and they'll run for 15 weeks starting January 17th at 7 p.m. That's the tentative time, starting date and time. And we're very excited about reaching as many people as possible to have this course provide the information we need, not only to make better decisions, but to bring the issues to the wider community in where we live, and hopefully to have a nationwide discussion as to what's the best way to move forward in order to reduce that $4 trillion medical bill and have better outcomes.
Okay, well, great. Well, folks, my guest this week has been friend of the Mises Institute, Murray Sabrin. Murray, thanks so much for your time.
Thanks, Bob. It's always a pleasure.
Thank you, everyone, for tuning in. We'll see you next time.
Check back next week for a new episode of the Human Action Podcast. In the meantime, you can find more content like this on Mises.org.